Richard Wolf Medical Instruments has been manufacturing rigid endoscopes for over 100 years. Rigid endoscopes are integral in minimally invasive diagnostic and operative procedures. It is essential to teach staff members proper care and handling of rigid endoscopes to ensure they are in working order for patient care.
I've had a long career, and over my career there's been tremendous change in what's happening in sterile processing and in the operating room, but there are still a lot of areas where there's additional education and reinforcement of that education that's needed.
There are two primary types of rigid endoscopes, diagnostic and operative. A variety of sheaths and trocars, like the one shown here, are used with diagnostic endoscopes to allow instruments and fluids to enter a body cavity or an organ to perform surgical procedures. Some diagnostic endoscopes utilize stiff glass rods to transmit the image from the surgical area to the endoscope's eyepiece. An operative endoscope has both visual and operative capabilities because the sheath is integrated into the scope. This integrated sheath allows instruments and fluids to enter a body cavity during a surgical procedure. The endoscope shown here is a type of operative scope that uses fiber optic bundles to transmit the image from the operative area to the eyepiece instead of stiff glass rods. The fiber optic bundle allows the scope some flexibility to move through the anatomy more easily.
In treating patients today, every single individual who is responsible for taking care of that patient in any manner, shape, or form is an integral part of that team. The CSSD technician is responsible to provide the tools and equipment that that surgical team needs, because without that equipment, they can't function.
There are four primary parts to a rigid endoscope: an eyepiece, a scope shaft, light post, and an objective lens. Each rigid endoscope has an eyepiece that allows the surgeon to view the operative site, either by looking directly into the eyepiece or by attaching a camera that projects the image onto a monitor. The shaft of the endoscope is located between the eyepiece and the objective lens. The shaft is metal and houses the light fiber bundle and the optical bundle or optical chain. Connected directly next to the eyepiece is the light post. Fiber optic light fibers are bundled together to transmit light from the light post to the distal end of the scope via a light cable attached to the scope's light post. The objective lens, located at the distal end of the endoscope, determines the angle of view for the surgeon, such as forward or 0 degree, lateral, oblique, or retrograde. Proper handling techniques can prevent damage to the optics and light fibers of the scope. Handle the scope by holding the eyepiece in the palm of the hand and pointing the tip of the scope upwards. This handling technique can prevent bending the scope shaft and damaging the objective lens and eyepiece during transport. Scope damages can negatively impact patient care and often result in costly repairs or replacements.
Richard Wolf is dedicated to giving you the information that you need to have the confidence to clean the endoscope so that your patient is well cared for in a safe manner.
Please refer to the Richard Wolf Instructions for Use Manual for the unique care and handling considerations for each type of rigid endoscope. The cleaning process for rigid endoscopes begins at the point of use, immediately following the procedure. Disassemble any endoscope attachments and discard any sharps, like loops or blades, before transporting to CSSD. Check for any obvious structural damage to the lens system, scope shaft, or light post. Early detection of damage is important to ensure the endoscope is repaired as soon as possible. Clean the endoscope surface with sterile water, tepid tap water, or enzymatic detergent, and a soft, lint-free cloth. Flush the channels with water or cleaning solution and a 20 cc syringe. Rinse the endoscope surface and channels with water to remove any residual debris and detergent. You may use a pre-treat spray that has been validated by Richard Wolf instead of this manual pre-clean process. Rigid endoscopes are very vulnerable during transport and can be commingled with other instruments that are heavier and could damage the scope during transport. Separate the endoscope from other instruments before transport. Place a Richard Wolf scope protector onto the endoscope as appropriate. Contain the endoscope in a tray by itself or in a separate transport bin from the other instruments. The rigid endoscope is now ready to transport to CSSD. Remove the endoscope from the scope protector or any assemblies and sheaths not yet disassembled in the patient care area. Inspect the shaft of the endoscope to detect any dents or scratches. Inspect the optical lens and eyepiece lens for any cracks or fogging. Check the epoxy by the optical and eyepiece lens to ensure it is intact around each lens. Next, remove any adapters, sealing membranes, sealing caps, and stopcocks from the channel ports of the endoscope. Stopcocks may be metal or black plastic. Black plastic stopcocks are removed after each use to clean the ports. Replace with new stopcocks when they don't fit tightly into the stopcock housing. Metal stopcocks are usually not removable and must be in the open position to properly clean the ports. These removable membranes, stopcocks, caps, and adapters help prevent fluids leaking from the endoscope during a surgical procedure and are crucial to the endoscope's functionality. Rinse the endoscope of any residual gross debris or pre-cleaning products with tepid tap water. Do not use an ultrasonic machine to clean rigid endoscopes. This machine will dislodge the optical and lens systems and may result in an expensive repair. Place the endoscope and attachments into a sink with the correct dilution of enzymatic detergent and processed water to soak for 5 minutes. Use the correct water temperature recommended by the chemical manufacturer. Enzymes can become inactivated with the wrong water temperature. While the endoscope is soaking, thoroughly brush the attachments with the brush size that corresponds to the channel size of the endoscope's attachment. Rinse attachments with processed water and keep them in one place to ensure they are with the endoscope for final assembly. The endoscope cannot be used for a surgical procedure if the parts are not with the scope. The rigid endoscope is now ready to be cleaned. Use the correct sized brush to clean the endoscope's channels. The diameter of the endoscope should match to the size of the brush bristles. The bristles of the brush should touch the surface of the channel without folding or bending the bristles. Brush the endoscope channels with the endoscope submerged in the enzymatic solution. Make sure the brush moves completely through the channels without kinking or bending the handle. When possible, use disposable brushes. Disposable brushes work best if the handle end is inserted into the channel first. Push the brush handle completely through to the distal end of the endoscope. Pull the brush handle and then the brush out through the distal end of the endoscope. If using a reusable brush, ensure that the brush is routinely cleaned and disinfected per the manufacturer's instructions. After brushing, flush the channels with enzymatic detergent solution using a pressure device, like the one shown here, or a 20 cc syringe to remove any loose debris. Rinse the endoscope's channels with processed water and a water pistol, a pressure device, or a 20 cc syringe. Rinse thoroughly to remove all detergent residue from the scope or channels.
If we do not properly clean inside of all the channels, all the nooks and crannies, debris can actually be hiding in there.
A machine that helps with the cleaning as well as any steps of the reprocessing for an endoscope is clearly a step above doing a manual clean. And we here at Richard Wolf believe that the first and most important piece of using that machine is still doing some of the manual clean steps. Most importantly, doing the brush, flush, and the rinsing of the channel so that debris that has been inside of the channel has been loosened.
Always check the endoscope's manual to ensure the automated washer disinfector has been validated to decontaminate and disinfect the rigid endoscopes and instruments. Use the correct baskets, carriers, and connectors for the endoscopes and instruments to ensure thorough cleaning and prevent damage. Use compressed filtered air or a 20 cc syringe filled with air to dry the endoscope's channels. You may also flush the channels with 3 to 5 cc's of 70% alcohol to ensure the channels are dry before clean storage or terminal sterilization.
Because moisture in lumens is one of the precursors to formation of biofilms. Biofilms can really cause a significant infection in a patient. Very important step in instrument processing of scopes.
A rigid endoscope may be validated for high-level disinfection using chemicals like glutaraldehyde, OPA, or liquid hydrogen peroxide. High-level disinfection may be used in the decontamination process or for immediate patient use. Always refer to your hospital's protocol and the Spalding classification system when using a high-level disinfectant to process instruments for immediate use. Refer to the endoscope manufacturer's instruction manual to ensure the high-level disinfectant is validated to use with the scope. First, perform the daily quality test for the liquid disinfectant. Completely submerge the dry endoscope in the high-level disinfectant and use a syringe to pull the disinfectant through the channels. Place the lid onto the container. Follow the chemicals label instructions for the prescribed exposure time. For immediate use, rinse the endoscope and channels with sterile water as per the manufacturer's instructions and transport aseptically to the patient care area for immediate use. If high-level disinfection is used in the decontamination process, rinse the endoscope with processed water as per the chemical manufacturer's instructions, thoroughly dry, and transport to the assembly area for inspection. The endoscope and parts are now ready for inspection in the assembly area. Inspect the endoscope adapters, stopcocks, caps, and any other parts that attach to the endoscope to ensure that they are in good working order. Check the rigid endoscope shaft for scratches, dents, or evidence of laser burns. Next, inspect the eyepiece lens and the optical lens for any cracks, scratches, and fogging or loose epoxy. Look into the eyepiece and focus on a surface 3 to 5 inches away. The image should be clean and crisp, with no fogging or any part of the image missing from view. The objective lens and eyepiece can be wiped with alcohol to remove any cleaning solution residue. Inspect the scope's light quality. Hold the distal end of the scope straight up to the ceiling light and look directly at the light cable post. The post should appear milky white with no black spots. A portable light source, like the one shown here, can also be used to check the scope's light fibers. If more than 30% of black spots appear in the light post of the scope, send the endoscope for repair. Clean and sterilize the endoscope before sending for repair. Next, inspect the light quality of the light cable. Hold both ends up to a ceiling light. Both ends of the light cable should appear milky white with no black spots. Be sure to check the manufacturer's instruction manual before reattaching any seals, gaskets, or caps to ensure they can be assembled onto the scope before sterilization. The light post adapter can be reattached for sterilization. Turn the adapter 1 1/2 turns onto the light post so it is slightly loose to allow for effective sterilization. Richard Wolf scope protectors are validated for sterilization. Protect the endoscope and keep it separated from the other instruments in the tray. Instrument trays made specifically for endoscopes and instruments also help separate and protect the endoscopes from damage. The endoscope is now ready for terminal sterilization.
I think the gold standard is terminal sterilization. So all of these scopes or any device that's a critical device, I believe should be terminally sterilized. And that means it's put in a package that is sterilized, and that package can then be stored on the shelf until it's needed. That to me is the gold standard.
Most of Richard Wolf rigid endoscopes are heat stable and have been validated to autoclave in a pre-vac steam sterilizer at 270 degrees for 4 minutes with a 20 to 30 minute dry cycle. Some rigid endoscopes may also be processed in low-temperature sterilizers. Please visit us at www.richardwolfusa.com for the most up-to-date information regarding alternate reprocessing methods, including instruments validated for low-temperature sterilization. The key points to use for effective care and handling of rigid scopes are: educate staff on proper care and handling of rigid endoscopes. Always pre-clean the rigid endoscope and instrument assemblies at the point of use. Always use proper handling techniques to avoid damage to the endoscope and lens system. Always check the function of the endoscope before assembling for next use. Always report endoscopes needing repair as soon as damage has been detected. And ensure all reprocessing steps and sterilization methods have been completed as described in the manufacturer's instructions for use manual.